Well, welcome and thank you for joining us for today's Moving Forward Together event. This is an ongoing collaboration by the Timberland Regional Library and the Capital STEM Alliance to highlight current and emerging trends throughout the Capital Region. For the past several months, our episodes have focused on some unique, high demand, high wage occupations for youth in our 5 counties that most people don't usually think of when looking for a career. Today, we're going to focus on nursing professions as a great gateway to a career in healthcare. My name is Lori Thompson. I'm the Capital STEM Alliance Director at Educational Service District ESD 113. And I'd like to acknowledge and thank each of our tech support staff, especially Lily Grant of Timberland Regional Library. And she will be recording our tonight's event and sending out the YouTube link afterwards. And just in case you miss an episode, our entire Moving Forwards Together series is recorded and placed on the Timberland Regional Library YouTube channel, where you can access it for free at any time. All you need is a library card. So this afternoon, we're going to be looking into the workforce gaps in healthcare occupations with a focus on the nursing profession in particular. So to kick us off, it's my great pleasure to introduce our keynote speaker, Susie Scott, who will provide us with an overview of the industry of nursing and the need to expand career pathways for youth in our region. We're going to follow up Susie's keynote address with a panel discussion with some experts who will give us some in-depth information about this exciting profession. So I'd like to introduce Susie. Susie is the Chief Nursing Officer at Providence, Swedish in South Puget Sound. And I'm going to go ahead and share my screen because Susie has a wonderful PowerPoint presentation. So if you just give me one moment. Whoops. There we go.
Well, thanks, Lori. As you're pulling up the presentation, I'll go ahead and get started. What an honor to be here to be your keynote speaker this afternoon. As Lori mentioned, I'm Susie Scott. I'm the Chief Nursing Officer for Providence, Swedish, South Puget Sound. So that's St. Peter Hospital in Olympia and Centralia Hospital. I've been with Providence now for 6 years and a nurse for 37. It's pretty amazing. I knew I wanted to be a nurse from the time I started probably kindergarten. It just really was something that excited me about taking care of other people. So how cool is it that nursing is that vital profession that forms the foundation of pretty much every healthcare system, and is what I consider the heart of healthcare. So I wanted to spend a few minutes today exploring the critical role that nurses play, the current workforce challenges that we have that make this such a great opportunity for our youth to join the profession of nursing. And then I'll touch on a few diverse career opportunities, but I'm going to leave a lot of that for our panel discussion because we've got lots of opportunity there to talk about different roles in nursing that people can play. And then also look at some pathways to enter nursing and advance your career in nursing going forward. So Lori, if you would mind just briefly pausing on the next slide, really brief agenda for you to cover in the next 15 minutes. I really address this in my introductory slide, but you've got this going forward for you. And then if you could advance 2 slides forward. Nursing really is at the center of healthcare. From a technical perspective, nurses really impact patient outcomes through a number of different opportunities. We're essential in delivering quality care, supporting patients emotionally and physically, and really leading health initiatives. And we have a really significant impact by patient monitoring. We contribute significantly to patient recovery and safety through that patient monitoring, administering different treatments, and providing education for our patients. It's the nurse's vigilance and expertise that helps reduce complication and improve health results. If you could flip to the next slide. Beyond the technical and clinical care at the bedside, nurses really are central in serving as an advocate for patients' rights. Nurses lead healthcare teams and coordinate care. They're really pivotal in shaping healthcare delivery and policy. As you can see from this slide, nurses actively promote and protect patients' rights and well-being within the healthcare system. They serve as that voice. I think of nurses as that heart of healthcare because we get to know our patients and ensure that they're known by the rest of the healthcare team. And you'll hear from our panel that nurses are really pivotal in leading multidisciplinary teams so that we can ensure that care is coordinated and we are effective in delivering healthcare to our patients. Laura, if you'd like to transition to the next slide. I love this picture that I found using Copilot and our AI tools that we have to us. When I asked for a picture about compassion, this is what our internet friends gave to me, and I love this picture because we really are there to provide empathetic care and address the emotional and psychological needs of our patient, and that really helps foster healing. We're here to provide holistic care to improve overall well-being and really help contribute to successful treatment outcomes for our patients. And we do this by providing emotional support, building and fostering trust. If we can ensure that our patients are known by the rest of the healthcare teams, they can then feel like they've got trust in the healthcare system and be able to really open up to our healthcare team, and then we can help further and enhance their health and well-being. This is a great time to think about a career in nursing. If you'd like to flip to the next slide, the nursing profession today faces significant shortages globally. This is driven by aging populations and increased healthcare demands. Patients have many more complex needs than they did when I entered the profession 37 years ago. And then understanding this is really key for prospective nurses. So if you transition to the next slide, current statistics reveal that there are critical gaps in nursing staff worldwide, with many healthcare systems reporting shortages that impact patient care and workload. We have roughly 5.8 million nursing shortages globally currently, with the US projected to have an 8.6 registered nurse shortfall by the end of this year. There are currently over 263,000 unfilled nursing positions across our country. This is going to improve in the next few years, but not enough to fill the gap. And we'll still have a 4.1 million nursing shortage by the year 2030. And again, that's just nursing. If you take the whole healthcare workforce, it's going to be about a 10 million healthcare worker shortage across the globe, which is pretty incredible. So many opportunities. This nursing shortage does have an adverse effect on our patient care quality and timely medical care. We need nurses at the bedside, again, to be that person that gets to know our patients and ensure they're known by the rest of the healthcare team. Because nursing really is the only healthcare profession that's with our patients 24 hours a day, 7 days a week when you're admitted to the hospital. If you can transition to the next slide, there's a number of different reasons that we have a nursing shortage right now. A lot of it is our aging workforce. Many of our nurses are at retirement age. And then, especially in the last 5, 6 years with the pandemic and the complexity of healthcare, that has resulted in a lot of burnout among our nurses. Couple that with limited training opportunities for nurses. Certainly, the ability to receive a nursing education, we have far more nursing students applying for nursing school than we have nursing spots for them in our nursing schools. And that's largely due to faculty shortages across the country. So this then increases stress on the existing staff, and then that in turn decreases job satisfaction and fatigue that again has folks turning to different professions. So having an added increasing workforce from our youth of today will actually have a positive impact on the quality of care that's delivered going forward. Next slide, please. So again, lots of increasing demand globally. Again, we talked about this with an aging workforce and increased complexity. There's certainly job security in nursing going forward because of this consistent healthcare need worldwide. And there's many more growing opportunities for nursing in different career opportunities with lots of technical challenges that we can face with nursing to be able to expand our workforce. So let's talk about some of those opportunities here in the next couple of slides. I love this quote. These shortages are not just challenges, they represent unprecedented opportunities for impact, leadership, and career growth in nursing. This really speaks to the incredible opportunities there are across the globe, especially here in the United States for nurses. Nursing offers diverse roles across both clinical and non-clinical settings, and I'm looking forward to hearing from the panel that'll talk about both those. But before our panel comes up, let's talk about this broad spectrum of careers available. If you could transition to the next slide, you'll see that nurses work in various clinical environments, providing direct patient care, managing treatments, and coordinating with healthcare teams. In a direct patient care setting, nurses provide that hands-on care. We support patients from a medical need and their emotional needs in various clinical settings, from the acute care hospital to clinics, and even in the home setting. Nurses also manage and administer treatments and manage that healthcare environment, ensuring that our patients are safe and they have effective healthcare and we deliver quality outcomes. That's a lot of what I do in my role as a chief nursing officer now. I don't have direct patient care assignments, but I do make sure that we've got nurses there at the bedside to be able to make sure we can deliver that care. And then nurses coordinate with all of our other healthcare disciplines, doctors, laboratory assistants, radiology technologists, pretty much everyone you can think of to be able to deliver comprehensive patient care. Let's look at our next slide and talk a little bit about some community and public health roles. Within the community, nursing focuses on health promotion, disease prevention, and supporting populations outside of the hospital setting and play a really key role in public health. Next slide, please. Nurses also contribute as educators, researchers, and administrators. They influence nursing practice, policy, and healthcare innovation. Nurses can specialize in areas such as pediatrics, critical care, perioperative nursing to go into the operating room, administration, which is where I am. There are so many different opportunities for career growth and expertise development. If you can imagine it, I'm sure there's a nursing career field for you there. Next slide, please. And again, there are a number of different educational pathways and career transitions and advancement opportunities for you in nursing. You don't have to necessarily take a traditional route of graduating high school and going right into college from a nursing role. If you transition to the next slide, certainly nursing education offers many degree options, including associate's degrees, bachelor's, and advanced degrees. Many nurses often start with a certification, such as a certified nursing assistant or other roles, and then transition into that broader nursing education from an associate's and bachelor's degree from there. And then once you have a degree, there are many certifications that you can obtain to advance your nursing skills and validate that expertise in specialized areas of healthcare. As an example, I started off as a medical surgical nurse and obtained my certification in med-surg nursing. I then did a little bit of a career transition and became an emergency nurse and worked in the emergency room. And then was a case manager and did a lot of the care coordination before transitioning into leadership roles. I was a nurse manager for a time and then a director of nursing and now a chief nursing officer. So lots of opportunities, lots of bridging programs to be able to provide those flexible pathways for nursing careers for you. Next slide, please. And again, as I mentioned, you can transition from many other professions and become a nurse through special programs that are designated for career changers. There's often accelerated nursing programs to offer fast pathways for individuals that are shifting careers from another profession into nursing. And we can talk a little bit more about that with our panel today too. So thank you so much for letting me talk to you. I've got one last slide for you. Just to remind you how rewarding and essential a career in nursing can be. There's so many diverse opportunities and really a strong demand. Pursuing nursing offers the chance to make a meaningful impact on health and well-being worldwide. So thanks for letting me spend a few minutes with you this afternoon. Lori, I'm going to turn it back over to you.
Thank you so much, Susie. Really appreciate your presentation. Before we go on, does anyone have any questions from the chat? I neglected to tell people that they can ask questions in the chat, and Lily's monitoring that. Lily, did you see any questions in the chat for Susie?
No, I don't see any in there quite yet.
Okay. So does anyone have any quick questions now? Because I have one. I always have a question. My question is there a particular uh, nursing field that is suffering a more severe shortage than any other, or are they all pretty much critical gaps in the workforce?
When I look at the statistics, both nationally and globally, it is a general nursing shortage. So you can there's opportunities with any career field within nursing, and you'll be filling a gap with that. So it's really where your interests lie. And there's opportunities to pursue different options to figure out what that is if you're looking at just general nursing.
Thank you. Okay. All right. Well, thank you so much. We are going to now we have some background information, and it's really exciting that you've told us all this because I feel like you've teed us up for the very next part of our presentation, which is our great panel discussion. So I hope we are able to address all of the topics that you brought up, Susie. I doubt that we're going to get to all of them, but we'll try. So let's, before we begin, I'd like to introduce our panelists and thank them all for being with us this afternoon and lending us their expertise. So you'll each have about 5 to 10 minutes to respond to our questions. And if you have any materials that you'd like to share, feel free. If we have extra time, we're going to give you some follow-up questions as well. And we will take questions from our participants if they have any. And please put your questions into the chat, and then Lily will share those with us. So we're going to start with, let's see, we have 4 panelists with us today, and I'm really pleased to introduce them. Our first panelist is ShaunaLee Martin, who is an associate professor at Centralia College. And we have Dawn Greene, who is a nurse manager at Providence Street Medicine. Hannah Heinonen, I hope I said that right. She's a family medicine nurse practitioner at Harbor Regional Health, And we have Chris Saelens, who's our healthcare sector lead at Pack Mountain Workforce Board. So the panel discussion, we have plenty of time, and this is going to go until about 4:45. So we have lots of time to talk about occupations in nursing, transferable skills, multiple occupations, and career pathways. Okay, so if we are ready, we're going to start with ShaunaLee. So ShaunaLee, would you like to introduce yourself and tell us a little bit about what you do, where you work, and some of the duties that you have?
Lori, I think unless ShaunaLee's under a different name, I'm not sure if
Oh dear.
she
Okay,
was
she
able to
wasn't
make
able
it.
to make it. Okay.
Yeah.
Okay, well, we'll move right on. Okay, so let's go to Dawn. Dawn, you are the nurse manager at Providence Street Medicine. What is street medicine? Can you tell us a little bit about what that is?
Sure, absolutely. So glad that everybody was able to get on today. So my name's Dawn Greene. I'm the nurse manager with the Providence Street Medicine / mobile outreach. And what we are is a small team comprised of myself, a provider, NP, MD, and a social worker. And our primary responsibility is to serve the unhoused population within Thurston County. So we are out providing primary care, interventional care, behavioral health care, connecting individuals to any of the community resources, and working with unhoused individuals to help maneuver some of the barriers that are in place and do some shared responsibility with improving health outcomes as well. So that's kind of us in a nutshell right now.
Okay.
We, a little bit of background, we have grown exponentially the past couple of years. The street medicine team has been around since 2021 with a couple of iterations. So we are a big proponent of the community health portion of nursing, which Susie was talking about within the population health. In 2024, we had the opportunity to serve about 800 different individuals within Thurston County who had identified as being unhoused or unstably housed. In 2025, that number was more than 1,100. So it's certainly a public health issue, which is, another big focus with a nursing background. And it's just an opportunity for us to work closely with the hospital to reduce ED visits, and then, ensuring that everybody is receiving quality care and dignity care.
Thank you. What is your role at the Providence Street Medicine?
Sure. So I had the fortune of starting out as a field nurse within the program. And then as we've kind of repositioned and pivoted to some more growth and sustainability, I'm still doing the nursing aspect and providing care to individuals, but also as a role as a nurse manager. So currently working on a sustainable model, a lot of collaboration and leadership with community partners and scheduling different providers and so forth. So it's kind of a catch-all job right now. Love it though. Love it.
It sounds wonderful and extremely busy.
Very busy.
Is it just, are you a one-person operation or do you have a staff?
No, we're a small group. So right now it's myself as the nurse, and then we have a master's level behavioral health specialist, Jason, who does an exceptional job. We have a logistics driver, and then we have a provider. Currently, right now, we have a physician that works with the residency program that supports the unit, which is amazing, and then a nurse practitioner that we are currently in the process of looking to hire for. And we all kind of work together. We all consider ourselves generalists because we're all kind of cross covering. And then our physician is also an addiction specialist. So from a nursing perspective, we get to see everything and then really collaborate with partners within the community.
Sounds like you cast a fairly wide net
We
there.
do. We do.
I'm really curious, how did you, um, what was your journey like get into this particular role?
Sure. So I've been a nurse 26 years, and I originally started out in adolescent psych, which was important to me, and have always drifted towards the populations that seem to be underserved within our healthcare system, which has been a lot of mental health. I worked within some of the HIV clinics in the early 90s when we started to really identify appropriate and quality care, and then kind of moved into the geriatric population within their mental health and leadership, and then kind of worked my way back down to bedside nursing within an outside kind of service model. So that was my very long path to over here.
That's awesome. I mean, it sounds like you work with quite a large array, the
Mhm.
spectrum of population, from adolescents to geriatrics. That's quite a bit. It sounds like you need a lot of knowledge and a lot of experience to get to that point.
Well, yeah, and that's the beauty of one of the things that Susie was talking about is there's so much width to what you can do as a nurse, and the ability to change and pursue a different part of nursing, and then it kind of all comes together. I don't think I would be as successful as I am today with the street medicine team without having had the other experiences that have led me to where I am today.
Okay, so I'm going to save a question for all of you at the end, so I'm not going to ask that yet. But is there anything else you'd like to tell us about the needs of the needs for street medicine?
Sure.
Yeah.
Um, the unhoused population is just getting larger. It's an underserved population, and it's a group of individuals that requires a lot of collaboration. We do deal with addiction. There's a lot of trauma that this particular population has experienced, um, a lot of judgment, and a lot of mental health issues. So it's been important for us to work on this street medicine team and as a nurse to really kind of bring the parts of nursing that have been so important, which is, the empathy and the kindness and the ability to educate. There's kind of this thing where some studies have shown if we can give an individual just 2 minutes of our undivided attention, we can have such a great impact on their pursuit in their own health and an ability to engage. And that's what we do. Sometimes we're just listening for 2 minutes. So yeah, it's the best job I've ever had within my nursing career so far. And Susie knows that.
That was a very powerful statement, that 2 minutes. And I've seen this in hospital settings, clinic settings, urgent care settings as well. Just listening to someone sounds like, I mean, it sounds like such a simple thing to do, but sometimes it's something that it doesn't come naturally to a lot of folks. And especially when they're under a lot of stress, and have medical issues also. So that's a really powerful statement, and it sounds like something that the nursing profession elevates above all else, at least from what I've seen,
Oh yeah.
in pretty much every setting. It's always the nurses that come through,
Yep.
that the boots on the ground level.
Boots
They're
on the
the first
ground.
line, right?
Yep.
So how in your daily life, how do you encourage clients to keep returning, especially if, if they're unhoused or they have transportation issues? I mean, that seems like it would be a difficult, constantly always looking to figure out how to get in touch with these folks.
Yeah, so we're lucky enough that we have a mobile RV unit that allows us to park twice a week. Then, and I think the simplest answer to that is we have diligently worked as a team to develop trust. as difficult it is to gain. We are where we say we're going to be, and they have come to know that they can rely on us to be forthcoming, and to do what we say we're going to do, and to treat them with kindness and respect and dignity. So in the last year, we've really seen where they are seeking us out. They work with community partners. My phone rings all day long of Dawn, where are you? Which is great. If we can reduce ED visits, which reduces their own internal stress and barriers to care. So I think developing that trust with the community, and then they speak to other members within their own community, because the unhoused really is a community within themselves, has allowed us to provide a lot of the care that we've been able to provide throughout Thurston County.
It sounds like everyone is lucky to have you, and I can understand why you get many, many phone calls all the time. You must be a very busy person.
We are busy. We are busy.
Thank you for sharing that. And I will have a
Thank
question for
you.
you after we come back around.
Absolutely. Thank you.
Appreciate that. So our next panelist is Hannah Heinonen who's a family medicine nurse practitioner at Harbor Regional Health. Thanks for joining us today, Hannah. You work in a clinical setting rather than a hospital, correct?
Yes.
Okay, so what does a typical day look like for you?
Well, I work 3 days a week, three 8 to 10 hour days, I would say. And I arrive at the clinic, 8 o'clock or so, half hour before the first patient shows up, address my inbox, look at who's coming in that day, and kind of look at their last visit, see what they're coming in for. And then I see 7 patients before lunch and 7 patients after lunch. And they are from ages 18 to 100, and they could be coming in for any reason. Anxiety, depression, diabetes, hypertension, those are pretty common. But there's people come in with everything, and I like the variety. Sometimes every appointment is a different chief complaint, and I also do some procedures like cortisone injections, like for knee, shoulder, and hip, and pap smears, removing skin lesions. So there's a lot of variety, and I like working with my hands. And at the end of the day, usually I'm there an hour later, finishing up my documentation, charting. I like to keep my inbox at 0. And the just working 3 days a week helps me maintain some balance. And then 1 day a week, I also work in our wound clinic for half of the day. So I started that 2 years ago, and I love it. It's a real team approach. There's usually like 3 nurses and a nurse practitioner or a physician. And we're seeing patients with chronic wounds. So wounds that have not healed within, the expected amount of time. Usually they have some sort of disease process that makes it harder for them to heal a wound. And then we're a team that tries and problem solves and sees them usually every week until hopefully their wound is healed. But that's what my week looks like.
Very busy. A lot like Dawn's. And like Dawn, you're kind of a generalist. You address all issues, and you never know what you're going to get from day to day. I'm sure that's pretty exciting, though 2 days are the same. Um, aside from becoming a nurse practitioner or a nurse, or going into the nursing profession and doing what everyone has to do education-wise, are there any specific skills that you would recommend for someone who is interested in going into your line of work?
So for me so I'm a nurse practitioner in a clinic. I think any situation where you can, shadow someone, or because there's so many different nursing roles, and I did not even know during school if I would like the job. That's one of the beauties of nursing is that you can pivot and you don't have to go back to school necessarily to be retrained on something. So I would say take every opportunity to, shadowing someone for a day, you learn a lot about whether you might like something or not, or just uh, um, talking to someone about what do you like about your job, what do you not like, because I told you a lot about what I do like about the job, but there's plenty I don't like too. But it's that said, it's the best job for me for sure. But yeah, I would say so. Outside of the schooling, that would be what I would recommend.
Great. Having been to clinics, knowing lots of people who do go to clinics instead of maybe the emergency room. Um, I know that a lot of it has to do with time and what being seen in a timely manner. Do you find the environment, maybe, I don't know if you've ever worked in a hospital setting, but do you find there's it's the same or any different about the amount of pressure, stress, in a clinic as versus a hospital setting?
I think there's definitely a difference, but I was not I never worked in the hospital. So I did do clinical rotations there in school and I did not like it. So it was a little too intense for me and I was a little too stressed in that setting. So I really like the outpatient clinic side because yes, emergencies can happen anywhere. But knock on wood, it's a lot less frequent in the outpatient setting. And there is, some days are definitely stressful with time, like I can be up to 30 minutes late to a patient appointment because, maybe my first or second patient of the day needed a lot of extra attention. And that can be stressful because you don't want the patients to wait. And then it can be stressful when you have, oh dear, I have six more people and I'm already half an hour late. But you learn how to manage that and it feels a little more comfortable and you get better at managing your time every day. So I kind of like the challenge in that sense too, because when you're on top of it, it's very rewarding.
I can imagine how it must be very rewarding to be able to help folks with hopefully minor problems as opposed to being in a hospital setting. Um,
hmm
so I'm just curious, and I know I'm not alone in this, but sometimes when you go to the doctor, you go to a clinic, you see the initials after someone's name, RN, LPN, whatever. Can you kind of distinguish for us what some of the differences are and what the educational training needs are for at least a few of those? Because I'm
Yes,
confused.
yes. Yes, there's a lot of roles and a lot of letters. So for me, I'm an ARNP, so Advanced Registered Nurse Practitioner. I'm also a DNP, a Doctorate of Nursing Practice. So to be a nurse practitioner, you have to have either a master's or a doctorate. So I did the doctorate, so that was I had to do 3 years in addition to becoming an RN. And let's see, so there's LPN, also licensed practical nurse. I think yes, Susie's nodding, and that is less training. And then CNA, certified nurse assistant. So I started there. A lot of us started there. And that one I had to do, I think, just maybe a 6 or 8 week course, a couple months course. And then you can kind of work. That's probably the lowest level of nursing. So you're not giving medications, you're more helping uh, patients in a lot of settings. I worked in a nursing home, so I was working with maybe I'd had 10 patients assigned to me, and I was um, getting them all ready for breakfast, helping them get to the toilet, helping feed some of them. And I do like the how in nursing we do have to go from one step to the next generally, and we all start there. And that job, a CNA, is has been the hardest job I've ever worked. It's very a lot of labor physically and uh, mentally challenging too. But I've never worked a job where I've been with a patient for 8+ hours. Now, and I'm seeing them their entire day. I'm kind of the closest person who sees them every day. So that's a different kind of rewarding, and I don't have that in my clinic now. I see the patient for 20 minutes, and then I'm done until next month. So I do miss that connection. Um, but so now as a nurse practitioner, I'm able to prescribe medications, and I have a much bigger scope, I would say. So, and I think I only covered like half of the the positions that you mentioned. Um, but yeah, there is a lot.
I appreciate that. I've always been confused by all the different levels, and I'm sure a lot of other people are too. And I see that Don came back on, and Susie, I'm curious. I'd love to know your take on this. So, from an educational perspective, it sounds daunting, to get to where all of you have gotten. Um, and I don't know what keeps you going. And I'll throw this out to anybody, any of our panelists. What keeps you going? What motivates each of you to pursue this wonderful but very stressful profession?
I'll jump in and start. I think Dawn said it so well. And it's I know what keeps me going is being there to ensure that our patients have a voice, to ensure that they're heard and that they can trust in all of the healthcare providers that take care of them. So it's that certified nursing assistant that Hannah mentioned that's there with the caring touch when they wake up in the morning to bring them breakfast, to take them to the bathroom and help with bathing and other activities of daily living. It's the registered nurse who is ensuring that they've got a good plan of care and acting on the treatment plan that our nurse practitioners have put into place at the bedside or in the clinic. It's the nurse practitioner who is providing that listening ear every month. That's what keeps me going. And as a nursing leader, as a chief nursing officer, my job now is not taking care of the individual patients, it's taking care of the healthcare team and making sure that our nurses have what they need to be able to take care of the patients. That's what keeps me going every day. It's so exciting. And as Hannah mentioned, you can start as a certified nursing assistant, or you can jump right into a baccalaureate degree. There's just so many different options to be able to get to that heart of healthcare and be that nurse at the bedside.
Don, do you have anything you want to add?
No, Susie said
Okay.
that all beautifully, so I'm good. I'm not following that up at all.
Okay.
I would
Uh,
say,
Go ahead.
just to chime in, agree with everything. What part of the what keeps me going business is balance. I would be lost without my schedule, and it's burnout is real. So you have to evaluate what you need, and I knew that I needed some. I have 3 very difficult days, but with the time off I have, with the schedule I've worked out, that's just fine for me to come back and ready to provide care to my patients, and feel inspired, and be able to spend those 2 minutes, or more intentional time listening to a person, and making them feel heard, and making sure you're hearing them. So uh, balance is really important.
And having said that, I'm going to ask Susie, as someone who helps oversee the nursing profession as an administrator, how do you keep morale up amongst those that you supervise?
It's making sure I listen. And
Okay.
again, going back to Dawn said it so well, that 2 minutes, just making sure that our nursing team is heard, making sure that they have the resources that they need to be able to manage the burnout that they're feeling, to have that balance in their schedule, and take care of themselves as much as they take care of our patients. So making sure that all of those resources are available is what my role is as the chief nursing officer.
Appreciate that. Thank you. I'm going to move to Chris. And Chris is our healthcare sector lead at Pac Mountain Workforce Development Council here in Olympia. And Chris, you're sort of in charge of the workforce aspect of nursing, correct?
In a sense, yes.
Okay. So I want to start with a question that I have heard this from so many young people who really want to go into the nursing profession. And I believe, as Susie has mentioned, there's a huge lack of faculty who are trained to instruct up and coming nurses. And especially in our region, I want to say, especially in the rural communities, how does one get connected to becoming a CNA? How does one start that whole journey? And I know that it gets harder and harder as we go further and further. So, coming from a rural region or a rural community, I know this is a terrible question to ask you, but and I know you have a PowerPoint, but I have a question in here first. How would you recommend someone get started on that journey? You can't go from just being a CNA to an advanced nurse practitioner, an ARNP, like Hannah was. Um, what would you recommend? How do we get started?
So, and no, and that's a fantastic question. So, a part of what we do is we look into a lot of the ways to educate people how to get started, right? So, you could do a CNA program with a local training provider, right, that has been approved to be able to provide that training, to be able to prep someone to take that license, right? Um, you can also, we always inform people to do the research with what employers are locally in the area as well, and to peruse isn't the right word, but like visit their local employer website, right? Look at volunteer opportunities, look at what programs employers have to support individuals in getting into these professions. And then you also have, sorry, my phone just went off and it got a little bit
It's
distracted.
fine.
And then we also encourage individuals to figure out what is the best starting point for them, right? There are individuals that can right out the gate go for that 2 to 4 year schooling to get into registered nurse, right? That may not be a path that's always available to everybody. So look at some of the more entry level roles like we've heard in here, like the NACs, right? Or the CNAs. Um, and we try and play a role in that as well. We hold our career pathway workshops to bring that information to individuals. We open them to the public. We partner with our partners that try and do outreach in some of the rural areas, like in Pacific County, like in Grace Harbor, like in Mason, like in Lewis. And so, in those workshops, we always try and invite guest employers as well to help kind of coach individuals. Because while I can sit here and talk about it all day, a lot of the times the people that are really going to make the impact on someone's choice on if they want to get into nursing is going to come from someone who's working day and day in the field, who is specializing in that. I hope that kind of answered your question. And if it didn't, please tell me it did.
No, it did, to a degree. And I know that this is, this is just something that healthcare has been a tough sector to enter. For at least the people that I talk to have always, it's been difficult. I hear from a lot of people. And I have one more question for you before let you get to your PowerPoint. But do
Absolutely,
you,
go ahead.
and I don't know if you have this in your PowerPoint, I'll stop, but do you have any data beyond? I know Susie had mentioned some data in
Mhm.
her presentation about the shortage of nurses and the workforce gaps. Do you have any more regional type data that you can
Yes.
share? Is that in
Yeah,
in your presentation?
yes, it is.
Oh, excellent. Okay. Here's what I'm going to do. I'm going to go ahead and share my screen and I'm going to let you do your PowerPoint presentation. All
Awesome.
right.
Thank you.
Okay. It's taking a slow time here.
No worries.
All right. There we go. All right. Can everybody see that? Got it? Okay.
Yeah, so when we're talking about healthcare, we really did this focus on nursing for this episode. And so we have us down there, and we also partner with organizations like WorkSource, and we partner with other organizations like Community Youth Services and Gravity Learning Center as well to kind of help youth in the areas. And so if we go to the next slide here. So when we're looking at jobs in demand, and this is the overview of the data, and the next slide we'll kind of go into it a little bit more. So when we're looking at jobs in demand, these numbers are reflecting the Pacific Mountain region. So that's the 7,000 square miles, the 5 county region for Lewis, Mason, Thurston, Pacific, and Grays Harbor. And so across that, when you're talking about healthcare work sites across that region, we're looking at 765. And so this number came from uh, work sites that contain the like essential jobs that require more training than just entry level positions, which is really encompasses nursing as well because you need training to do nursing, right? And so and this is across that 5 county region that we were talking about. And so with that 5 county region, we have over 6,174 people employed in nursing professions, right? And so when you're talking about that 7,000 square miles that we're looking at for that region, to what Susie said earlier, with now put it on a global scale where you have, I can't remember the number exactly in Susie, but it was around, was it over 200 million or something like that for the shortage
So
globally?
globally, right now, from a health in 2030, all healthcare professions, it's around 10 million. And then
Yeah,
in the United States, about 264,000
260.
gap in nursing shortage.
Yeah. And so when you take just how big that is on that scale versus the scale we are within this region, like it really shows like even in this smaller scale, it's really affected. And so when we're looking at new jobs, we're looking at over 7,000 new jobs. And if we go down to the next slide, it kind of explains the data a little bit more here. So what we've done here is we've looked at different occupations by their SOC codes, and we've had individuals run reports. And so when we're talking about nursing, from like home health aides to nursing assistants to registered nurses, right? Medical assistants is also on there. You're looking at current employment levels here. So when we're talking about that current employed, these highlighted sections for where it says EMPL, that just means currently employed, is adding up to that 6,000 number, right? And then we covered some annual wages, and these are average annuals, and so they can fluctuate based on when you're living, who the employer is, what they're offering. And then we're also looking at exits as well, right? People leaving through either whatever some personal reasons maybe, or people promoting up into higher roles and their previous jobs have now become open, or through expansions and through new facilities opening up. It could be any number of reasons. And so that also includes transfers as well, right? And so over the next 10 years, We're looking at these numbers on the right for the total demand. I hope the highlighting is okay for everyone to see. So for the total demand, that's where that 7,000 number comes from, right? So now we're looking at total demand for home health aides, for nursing assistants, for registered nurses on that 7,000 number, and that's just in that 5-county region alone. And please feel free to stop me at any point in time if you guys have any questions.
Chris, I do have a
Yeah,
question.
go
Of
ahead.
course. So the wages that represents our 5 counties as well. So the wages could be higher depending on what county you're thinking of. For example,
Yes.
King County would be higher wages,
Hmm.
right? Okay.
Yeah.
Okay.
And so if we go down to the next slide down here, so looking at some nursing pathways, so what we really try and focus on when we're looking at our role is what some of the entry level ones are. Could you scroll it down just a little bit lower for me here?
Sure.
Thank you. And so what we try and do with these pathways is inform individuals what are the various pathways you can take. So like we were saying before, you could do CNA, referred to as NAC as well, right? Which is like 4 to 12 weeks, depending on where you go for a training provider. We've seen them from 4 to 6 weeks to 3 months at a different training provider, right? And kind of what their roles are, we kind of try and break that down for people. Through what we've learned and then also through feedback from employers we work with as well. And so we tell people like you can go into this 4 to 12 week typical training for a CNA NAC, and then work in kind of the field you want. Are you wanting to work in that clinical setting? Are you wanting to work in like the nursing home setting, in the home health setting, or in like a hospital setting? And then if you don't have the capability or the resources to go straight to school to do registered nursing, you can start off in this entry level role of CNA, get to work with an employer, gain that work experience, and then learn from your employer as well. Look at what employers are in the area that offer things like tuition reimbursement, or I think I even saw Harbor Regional offered a paid education leave, right? And so, and I was very curious to learn more about that too. But looking at different pathways to further yourself in the career outside of just going straight to school and getting into the occupation, right? And then another entry point that we've seen quite a few times people take is instead of going through the regular CNA training, they would go right into the LPN training, right? It's a little bit longer, and LPNs can do more than CNAs can. But ultimately, they're participating in like the plannings and the assessments with the team and the implementation and evaluations of patient care, right? And so while, sorry, my mind just went a little bit blank. It happens quite a bit. And so, but these guys are ultimately still working under that supervision of the RNs, right? Or we see people that do go straight into 2 to 4 years of schooling for registered nurse, right? And so now they're kind of in that role where they can kind of still collaborate with the team, but now they're looking at having more of that competency and judgment, right? In that decision making, in that delegation of roles and tasks to people, right? They're using more of that critical thinking aspect because they're in that more of that leadership role. And if you go to the next slide here, so this is how we actively try and support. So through some of our partnerships, we have publicly available funds to help individuals with training services. So when we meet with individuals who are interested in getting into the careers but don't know where to start, and they want to go into that entry level role careers, we partner with organizations that are assisting in managing these funds to help with training services. So we can go ahead and assist and pay for people to get their CNAs. And then we track them through that training process, right? We even see people going in for medical assistance, right? And we support and paying for that as well. And then we track them through that progress. And then as they get closer to finishing that training, that's where my role kind of steps in. And then I meet with them and I talk about, okay, what are some of the options we're looking at here? Are you wanting to do home health? Are you wanting to do hospital? Are you wanting to go into a clinical setting? What are your long-term goals, right? Do you have transportation? What are some of the barriers you're facing? And then we take that information and then we help with that employment search service through employers we're partnering with. So we help them develop their resume. We help them with their interview skills. And then we take their resume, we encourage them to apply online to employers, but then we're also sending their resume to our network saying, hey, we have these 3, 4, 5 people that just finished their CNA training. Let's talk about getting them to work now, right? And while it is common, it's also common as well to see people gain employment through where they do their clinicals as well, right? And going down next to the employer partnerships as well, right? We not capitalize. We utilize our employer partnerships for that education piece and also that piece to help bridge that gap, because we see a lot of the times where employers do kind of, for certain roles, require that level of experience, right? And that's where we have the conversations with them. We also utilize the knowledge we learn from them through their resources on how to help support individuals, whether it is through programs, through gaining extra work experience through their volunteer website or volunteer programs on their website, right? Or through some of the programs we have to offer as well. And so when we're looking at these next bullet points and we're talking about like internships and stuff, so we have a program for our youth where we can do paid internships to help youth gain work experience, right? And a lot of the times is a youth interested in the field? Do they kind of know yet? And so we try and work on getting them internships in areas where we will cover their wages in a medical setting to see if it's something that kind of fits for them before they think about pursuing that license, right? And then other times we do have youth where they're already gung-ho, ready, set, go on the line to get to that training, right? Which is fantastic. And so we're trying to partner with employers on how do we tie in that internships with that clinical piece, right? So if someone can pass their clinicals, right, they can still continue on that internship path longer to gain more work experience. And it also kind of gives an employer an opportunity to see, does this person actually mesh well with the culture here as well, right? Because one of the biggest things that I've learned through my family being in healthcare, through working with our employer partnerships, is that healthcare is a very people-oriented job, right? And so how do people gain that skill if it's not something they're used to? And then we also look at what kind of on-the-job training opportunities are available. So if we do identify someone who really has a passion to get into it, but they maybe have only 80% of that skill set that an employer may be looking for, right? We try and use those public funds again to assist the employer in developing a training plan so we can see how this person can progress and how they can go from that 80% to that 100% in the job, right? So to kind of help close that gap, to kind of help offset some of that burden from onboarding and training and support. And then we have ways where we can upskill people too. So using similar publicly available funds through us, we partner with employers to upskill and promote their current workforce to kind of open those entry-level roles so that we can help fill those entry-level roles, right? So helping people along their career goal and career path to then help slide someone else in to get started, if that makes sense. I talk a lot, so I'm sorry if I rambled on there, but
Perfectly fine.
yeah, and I'm happy to answer any questions.
Oh,
Okay.
what was the name of your group again, Chris? And how do we refer people to you?
So I'm with the Pacific Mountain Workforce Development Council, shortly known as PAC Mountain. Um, Actually, with Harbor Regional, I've been trying to reach out and get a hold of someone in there as well. So I would love to connect further offline about that. But
Mhm.
yeah, no, I can go ahead and drop um, my information in the chat as well for you guys, for anyone interested in connecting. Um, it's been we've gotten to that weird point where like some previous people that we were connecting with inside of employer partnerships like either retired or left or like transitioned somewhere, and so like now we're trying to reestablish something. But yeah, here's my email in the chat for anyone that's interested in connecting.
And Chris, thank you for doing that. And somebody who asked in the chat, are there any programs, scholarships, or schools that are recommended for career changers?
Yes. And so, yeah, to answer that question further, we look at a website we actually use called careerbridge.wa.gov, right? It's a great resource to for that we don't put people through it. We don't force people to do anything that we refer people to. And so it has three key elements, right? It has a career quiz. So if someone's kind of undecided, thank you, Jeff. If someone's kind of undecided on which path they want to go, they have a six question quiz and a 30-question quiz. And the 30-question quiz will ask you, like, do you want to build kitchen cabinets, for example? And what it does is it takes your answers based on whether you agree or strongly disagree, and it lets you know, hey, your answers suggest with the skill sets in these career fields that you have a 76% match for health and life sciences, right? And so you click on that, and then it'll tell you what different careers are in there. So once you kind of decide where you really want to land on, you have a find education portion as well, right? And it shows you all the training providers inside of Washington State where you can get trainings from, right? And so we really, when we have people in our programs, we look at what's on the eligible training provider list. It's an extra step for training providers to get on for certain courses, but it's what allows us to spend the funds we have to help support. And then it also has a section on how you pay for education. And so we go into what does FAFSA look like? What do loans look like? What is a work study? What is grants and scholarships? And then if FAFSA isn't for you, because for a lot of times you have to apply for FAFSA to apply for a grant, right? What is Washington State financial aid, right? Or referred to as WASFA, which is, I love the name. It's really fun to say. And that is specifically designed for individuals who can't or are unable to use FAFSA, right? And so that is a lot of what our role is helping individuals find different ways to get to either starting their careers or transitioning from a career into the other one. How are those skills transferable?
Thank you. I have, as promised, I have one or two more questions for the
Go
group, the
for it.
panel. This is for anyone and everyone. I'm curious about whether there are any mentorship programs that exist in any of the pathways that you've all mentioned, that those who've gone through it before can kind of walk alongside those who are going through it now and kind of like just support them. Are any of you panelists aware of any mentorship programs that exist? Jump right in.
So sorry again to continue
Not
talking.
at all.
The mentorship, maybe not in the specific word being thrown around, but there are like volunteer opportunities where you work closely with individuals in the field that I see on employer websites, job shadow programs that are becoming available as well. And a lot of what we try to accomplish in our role is again, through our career pathway workshops, where we do invite guest employers to speak to inform people. and we try to sometimes set up informational interviews. We also try and be respectful of people's time as well. Um, but that's my answer to the question.
I know Susie had mentioned in her presentation that lots of folks are, well, I don't know what the percentage is, but there was a percentage who left. It's kind of like the education profession. You have folks who make it and then sort of drop off in the first few years. I was just curious as to whether there was a way to stem the tide, um, just keep people in the profession.
I did a residency program, which I'd really recommend. That's for if you've finished your schooling and the programs really vary. But for example, I graduated from nursing school, and right out of school, I did a rural residency, so in Aberdeen, and that's how I ended up here for a year. And then through our program, uh, three nurse practitioners were assigned to me, and one of them would just be available for me to ask questions as I saw patients as an extra support, which was great. And with those programs, your mentors, you really get to know them, and they still help me out. So I'd really recommend anything that has the word residency in it.
Ah, that's great to know.
Mhm.
Yeah.
Don, you wanted to, oh, I'm so sorry, Don or
Sure.
Susie, whoever.
No, I would say one of the good things that's happening now is, there's such an expansion of the different fields of nursing. What does population health, community health look like? So we're, looking to partner with some of the nursing programs. So, I would encourage people to even to reach out to some of the nursing programs and talk about what kind of clinical preceptorships that they do, that maybe we're not even aware of, that sometimes gives individuals an idea of different paths that they may have an option to take within a nursing career.
I was going to jump in and say, I wish ShaunaLee were on with us. I know that she would talk about the peer mentor opportunities that they have within the School of Nursing, just for the current enrolled students to be able to talk to future students, and then each class being able to help and support the next class coming forward. Many of our colleges and universities have those opportunities. And then, Hannah, I love that you mentioned the residency. Many hospitals also have a nurse residency program for new graduates, that partners a preceptor with a new resident for a year after graduation, to be able to make sure that there's that developmental opportunities moving forward with that. So, and then a lot of hospitals have mentorship programs beyond that initial residency too, just to be able to provide that coaching and development and information about what opportunities are out there beyond just a general nursing career.
That's so good to hear.
Yes, and with the nursing shortage, employers are desperate for nurses. So in your job interview, you can ask what mentors are available to me, or can I have someone that I can go to, or I can meet with once a month briefly, or something like that, because they'll want to support you, and if you're asking directly, they'll probably really want you to work there.
So good to know. These are all small little things that they don't tell you, but I'm glad that you're telling us now. I have one last question, and I don't know if you can answer it, but I'm going to throw it out there anyway. Has the introduction of AI affected either your profession or the pathway to becoming a nurse? And if so, how?
I'll answer first. Yes, it so I've been a nurse practitioner 3.5 years, and I would say I started seeing it in the last year or so. And so I didn't have the experience of having it available at school, but I've heard that can cause some problems because there's some very easy answers you can get. But it's been very helpful for me in the clinic. For like I use the open evidence tool that is an AI tool that scans published what am I saying? Research papers. And it can search thousands, and you ask a question and it gives you its best answer and shows where it got it. So I found that to be a good jumping off point. And you can also say, hey, draft a release from work paper. The patient, broke his leg, and then it just spits it out. So it's made my practice. It's been a life change or a life changer for my practice, making things easier.
Well, that's good to hear. Any variations on that? Good, bad?
I think it's just another iteration, a little bit of Google MD. I think we have the opportunity to put a little bit of ability for individuals to learn more about their healthcare. And I think it's important that, then they have the ability to have those discussions with providers and with nurses and, help us as well in the care that we're providing.
But I really see AI as an opportunity to be able to help our healthcare profession. People need a caring touch. They need that human contact and listening ear. And that's the beauty of nursing, is that's what we bring to the profession. And that's not going to go away with and be replaced by artificial intelligence. We're going to need that caring touch always in nursing. But to be able to have artificial intelligence to be able to rapid fire review the literature and find that research, to find the best treatment, to be able to, as Hannah said, to draft that note based on the information that we've gathered as healthcare professionals and put it together rapidly and concisely to provide that to the patient. That leaves more time for us to listen and touch and be there for people. So the future is kind of exciting with AI in that regard with healthcare.
I'll go ahead and hop in here too. And I promise I won't go on a tangent because I can talk about AI for a while. One of the things that I do use it in my job as well, right? And we also use it when we're teaching individuals like how to write their resume, right? How do you get past in ATS, right? An applicant tracking system utilizing AI and that kind of thing. And through any kind of subject revolving around AI. So I'm also the sector lead for IT and telecommunications as well. But for any kind of subject regarding AI, the most common thing that we try and teach and preach is that AI is a tool, right? It should not be used to replace any full facets of your work. It should be used as a tool to either bounce ideas off, to either train it, to cater to your work more closely. And the reason why is because AI, a lot of generalized and used AIs like ChatGPT and Copilot and all of those popularly used ones, they're generalized, right? And so you need someone that has the knowledge of how to correctly prompt the AI to get the correct result you're looking for. And so you have to learn the information of what you're trying to put into it before you just put something into it and take it at face value. So when I use it for my job, I call it out all the time, right? I ask it for a generalization, then I'll find a specific focal point I'm trying to go for, and then I ask it to cite its sources. and then it'll come back with different information, and then I'll ask it again, hey, I looked through the cited source, I didn't see this bullet point you mentioned, and then it will apologize to me, and then it'll say, here's what we know for sure, here's what's left up in the air. And so you have to learn how to use it as the tool as it is, and not the for sure answer that you want it to be.
And I would agree. And I also agree with what Susie said, that it does, when used correctly and wisely and cautiously, it does free up time for nurses to do their job and work with patients, because it is a very relational profession. And it was very well said. Well, I want to thank all of our panelists. If there's any other questions I don't see anything in the chat, but thank you so much for all the information you've given us. I want to provide a special thank you. I know she's on to Joyce Heck from Choice Regional Health, who reached out to all of you and convinced you all to participate today. So, Joyce, thank you so much for your help and support and just for your advocacy for the nursing profession. I really appreciate it. Is there anything else that any of our panelists would like to add?
I'll go ahead and hop in here. I would love to connect with everyone here, because I'm always willing and happy to learn more on how I can help support and to fill in my knowledge gaps as well. So I would absolutely love to connect with you guys further.
And you all have Chris's email. Put it in the chat. Pack Mountain. Thank you so much, all of our speakers and our presenters. This has been fantastic. I've learned a lot. I hope our audience learned a lot too. I'd also like to thank Lily Grant from Timberland Regional Library for doing all of our tech. And Lily is going to take the recording from today and put it up on the YouTube channel over at Timberland Regional Library. And Lily, you will be sending all of us a link. Is that correct? And then we're able to send that out to everyone?
Yes.
Awesome.
I should probably have that sometime tomorrow. I'll send it out.
Oh, great. Yay. Okay. So feel free to share that widely with everyone you know. It's free. And we aren't exactly sure when we're going to have our next moving forward together. We've been planning one on the hospitality sector, and we have Jeff with us from Pack Mountain as well, Jeff Bowe. Jeff, in the event that we do hold this, would you like to talk just a couple of minutes? We have about 2 minutes left if you'd like to give an overview of what we'd like to present.
Yeah, thanks, Lori, for organizing this, and I appreciated listening to all of the panelists. I just want to, just really quick, is anybody here watching The Pit on HBO Max? That is one of the coolest shows on TV right now with Noah Wiley and who's the nurse, the lead nurse, Catherine Danasa, I think her name is. She is fantastic, and I get chills watching that show. It seems it's probably a little bit over dramatized, but it just seems so accurate as to the life of a nurse. And so anyway, if you're not watching that, do it. Anyway, so back to hospitality. I hope we have this workshop. Right now it's scheduled for April 21st, same time, same place. And we've got a fantastic guest speaker lined up. Her name is Sonia Halverson. She's the education director for the Washington Hospitality Association Educational Institute. So she'll talk a lot about career pathways and maybe some things that we don't know about hospitality. So we'll look forward to that.
Awesome. Thank you, Jeff. Well, stay tuned for news about that coming up. And again, I want to thank Susie and Hannah and Dawn and Chris for being here and giving us all your knowledge. It's been fabulous. Really, really knowledge, sharing all your expertise. It's been great. So thank you for giving us your time and your professionalism. And I hope everyone has a wonderful evening. Thank you so much for joining us.
Thank you so much.